Good day, everyone. I'm Irene from Infection Control Department. Would like to welcome you in our live stream. Our topic for today is about respiratory triage. This is used to identify early identification of all patients with acute respiratory infection. And then, doctor, we will discuss our COVID-19 guidelines for the updates and also the policy, including our MERS code guidelines with also the latest policy. I will start first for our COVID-19 guidelines. In COVID-19 coronavirus guidelines, this is published by MOH only last the new updates. It was posted in the group. Okay, coronaviruses that are a large family RNA viruses that causes illness ranging from the common colds to more severe disease, such as Middle East respiratory syndrome. I just go to the brief discussion of this because we have some points to review regarding of it. And our objectives is to provide guidance on COVID-19 surveillance in healthcare and community settings, enhance rapid detections of confirmed cases, to determine the clinical and epidemiological characteristics of COVID-19 infections. This is to provide the guidance of infection prevention and control, the IPC practices, the standardized clinical management of COVID-19 patients, to provide guidance for rational use of resources, including our laboratory testing. Then serve as a quality control audit tool for COVID-19 surveillance. And they have the case definitions. Sorry for this. Yes. Patient with acute respiratory illness, sudden onset of at least one of following with fever. This is the case definition that doctors need to be applied during triaging in our visual triage station. Number 2, patient with sudden onset of at least one of the following: headache, sore throat, nausea, diarrhea, or loss of smell or taste, and 14 days prior to symptoms onset met at least one of the following criteria. Any admitted adult patient with an experienced severe acute respiratory infection, either community-acquired pneumonia. And the criteria for number 2, definition, case definition, you should know. Had contact and confirmed COVID-19 case. Working attended in a healthcare facility where patients with confirmed COVID-19 were admitted. And the definition of COVID-19 confirmed cases, the persons who meet the suspected case definition with, it's important, your laboratory confirmation of COVID-19 PCR. Now, what is the role of infection prevention and control? The principles of this is to early recognition and source control. Again, the application of standard precaution for all patients, the implementation of empiric additional precautions, the management of exposure COVID-19 in healthcare facilities, transportation of suspected and confirmed COVID-19 patients, the administrative controls, and the environmental engineering controls is included. And important also we need to be remember is the collection and handling laboratory specimen. I see how they collect the specimen that they sent to the laboratory. Environmental cleaning and disinfection after COVID-19. The infection control radiological examination for COVID-19. Next. This is the new guideline, doctor. So I just specified what's the importance to be remembered regarding of this. All the ER staff must know this. Our airborne precautions for aerosol generating procedures for suspected COVID-19. Huh? Use a fit-tested particulate respirator. This is mandatory. Always perform the seal check when putting on disposable particulate respirator. And then for nasopharyngeal swabbing, in case of non-availability, respirators, the healthcare workers can use what? The surgical mask. And face shield during the process. So they mentioned this only the two. Not at all. It is specified according to the guidelines. Available type of respirators are not fit to him should be avoided from aerosol generating procedure. And that's why we have competency tools regarding our MERS-CoV, doctor. This is the one I do, and I will give it to them. This competency tools means the training program that they need to know must be, especially the new staff, they must be aware of it. And then I'm the one also doing this observation. And Mr. Amir with my team, she is also responsible for the one with the competency procedures. Management of exposure of COVID-19 in healthcare facilities. Healthcare workers exposed to COVID-19 case. You should identify the trace of healthcare workers who had exposed confirmed COVID-19 case. Identify the risk category according to the management of healthcare workers exposed to COVID-19 guide. Patient exposed to a COVID-19 case prior to diagnosis due to the failure of implementing recommended isolation precaution. Okay, next. Now, regarding the transportation of suspected and confirmed COVID-19 patient outside the facility, I will discuss this on the second topic of our policy because this is guidelines. Means this is how do you your policy? You must have first your guidelines. But this is according to your facility. How to do it. Recommendation on personal protective equipment. Ambulance staff providing care for accompanying suspected confirmed COVID-19 patients in the patient section, the ambulance should adhere the standard and transmissions-based precautions. What is transmissions-based precaution? This is contact, droplet, airborne. And this is our transportation card that we need to know during transportation. Each staff must know this, not only the ER department, all staff. And they are aware just since last year. And what's the meaning of transportation card? To contact, we are color coded here. Green. When you say green, you will use what? This. Prepare the patient for notify receiving ward department diagnosis like this. Then prepare the patient for transportation. Staff should disinfect the patient's bed, wheelchair using MOH approved disinfectant. Our infectant use is for today is our Tristel disinfectant that we give to all critical areas that as used by our housekeeping department. Next is transfer for contact. For contact precaution, this is the rule. Healthcare workers, healthcare workers and visitors must, before patient room care, are entered for practice what hand hygiene, wear isolation gown, and before exit from patient room care area, what you will do? Remove your gown and gloves and discard it on a medical waste with biohazard sign, and then practice again hand hygiene. The last week I do it this in the all the housekeeping, our cleaner, and then airborne for our transmission-based precaution. If visitors report to nurse station before entering the room, of course you need to inform it. If you are a visitor, you need to report to our nurse station. And then next is before patient room entry, practice the hand hygiene. And airborne, what is the type of PPE you will use? Your only one N95 doctor. And what is the color coded of this? Blue. Okay. Sorry, doctor, because you did not. Yes, just sit up. No problem, doctor, because we have one Swaya slides there. If you see, it's okay, doctor. Now our topic is transmission-based precaution regarding transportation of the patient for, and what you will use. There's airborne. We are using color coded blue. Only N95 mask. N95 mask only for airborne cases. Not at all they can wear N95 as the order like this. This one. And then after exit from patient room, you remove N95.
What's the size? We have two sizes.
Yes, doctor. I will after I will yes, I will explain first, and then your question will be followed. Just this one, and then next. Yes, this is the one. That's why. Next is our droplet precautions. All healthcare workers and visitors must do the following: before patient room or care area entry, practice hand hygiene again. Wear a surgical. See, it's different. In droplet, you will wear what? Only surgical mask. But in airborne, must be N95 mask. The one N95 mask. And then before exit from patient room care, surgical mask must be removed and discarded to what I said before. I mentioned it. You will discard this, and the cleaner, we know that this already because we have lectured the last week. Dispose in the medical, dispose in the medical waste with biohazard as yellow waste container. And then in PPE, the first step is hand hygiene, and you will last step with hand hygiene. That's why I have this. And if the one stop come for this, the one, I will let her to do the PPE here in the ER. Okay, transportation card. This, when you bring the patient, example for the care area, like another facility and the other facility room department. Notify of course, the receiving unit. Prepare patient for transportation, and if the patient cannot tolerate wearing a surgical mask, help core workers wear surgical masks during transportation. It means that if the patient cannot tolerate, must be one of them. The first is the healthcare workers must have the surgical mask protection. And then staff should disinfect the patient bed. Staff should disinfect the patient bed, wheelchair, using approved disinfectant. Okay. Transmission bed. Contract droplet airborne and color coded. Contact green, droplet red, airborne blue, CDA. Very easy. Now, to continue, that's for our PPE use. How to proper way of PPE use during transportation of patient. Oh, by the way, doctor, this is new guidelines, and I will give you this on our desktop, on our board. Yes, yes, yes. Yeah, yeah, yeah. It's already there. It's already there, but I need to check, especially the staff, if they are follow to how to open this. And Baden Shwaya, doctor, I will just after this, just I will learn you how to the reporting, the Hasan, just quick only, so that you are aware of it. And then I will open my dashboard here, my password using here, just browse it, and I will explain to you because yesterday we have one. Uh, welcome, Jake. Our head nurse is here. Anyway, just sit down. We are already discussing the guidelines. We are now in the guide. This is the new updates of our guidelines. Okay, infection control for suspected confirmed cases in the radiology department. We have one X-ray machine just for the isolation. That's it. That's our one goal for it. That's for the break scan. Yes, yes, we have. Yeah, and I provide them a checklist. Yeah, portable X-ray. Yeah, just for the isolation. And then laboratory test. I will show you about it because it was there on the other side. Yeah, the specimen collection. Okay, our specimen collection now is the one who will transport is our driver. So it's Mr. Shiraj. This is the guideline. So it's many. So I will just and then we will go to the policy because the policy is
You have as PDF file for the.
Yeah, yes, yes, yes. It was. I already prepared this. Yeah, 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 yeah. It's already there. Complete, doctor. I will show you about it. It's here. Yes, yes, it's there. It's complete, doctor. Okay. It will show in the folder, our folder in the ER. I already prepared for it. And this one. Okay. This is the folder. Sure. See, this is the policy, the guidelines. This for policy with guidelines. This will you will see it in our dashboard in our desktop there. Yeah, yeah. Yeah, since you are not late, but this is the one. And then I will go first in the policy so that you know. We have two, and this one. This one. This is the one I ended. I just go click. Yeah, to provide guidelines for COVID-19 definition and treatment. This is our policy. Yeah, as I told you the other day, the case definition is already there in the bulletin board. I already put the new updates there in and they are to the MERS-CoV and the COVID-19. This is the guidelines now, the latest one. Who is responsible? All of us, all healthcare workers, the nurses, the physician, and the IPC team, the department. Why? To prevent transmission of respiratory infection include the healthcare setting. And the principles of infection prevention and control strategies. This I mentioned this already. You will see it. Ensure the following respiratory hygiene measure. Offer a medical mask, not N95, for suspected COVID-19 infection for those who are contaminated. Cover the nose and mouth during coughing or sneezing with tissue or flex elbow for others. Okay, I will ask you, doctor, just how do you do your respiratory etiquette? Cup etiquette. Cup etiquette. Cup etiquette. Cup etiquette. You will do like flex the elbow and do like this. not just like this. And we have picture now already here, poster. And it was mentioned, elbow, flex elbow for others. I mentioned that this is the one I told you. Anyway, your head nurse is already know this. She knows now already. Okay. Next. Yes, the storage and shipment. This is the one I told you the last minute ago. Hospital driver following appropriate regulations. The courier service is available for sample transportation anytime. Like yesterday, he come to me with two case and he bring a latul. And the treatment, since there is no treatment recommendation, is available, recommended to follow our guideline, the MERSCO treatment. And this is the attached form. Now we will go for the checklist. Just only, I will go for the guidelines. I will show you the checklist there that we use. The latest checklist. We already give the latest now. We changed now already the new one, the latest one. The scoring, our scoring system. Yes, this start our attach. This is the first checklist, the investigation form, and this we have. Okay, and then next this one, our contact tracing, daily contact follow-up form. This is included for novel corona. What is this? Name of patient, the ID, age, nationality, and phone number. Next is it's the same contact tracing form. Yes, this is it. Our triage checklist for acute respiratory infection. You know already, if it's score above, go isolation until. If acute respiratory, we will go to acute respiratory clinic. And then every swabbing, we will use sterile gloves, not latex only. We will use the sterile gloves, every swabbing. And this is the latest scoring. Exposure is, you will get the identification of the patient, name, like this, ID. And then you will assess the patient. Letter A, the exposure is to travel abroad 14 days, contact with confirmed case, COVID-19 or MERS-CoV, and then exposure to camel or products. What is the score? 3, a lot of 3. If you are score, it's 3. So count it as 3. Now, letter B, the clinical signs and symptoms added. Their fever, it difference at 2 tabulation. Pediatric, adult. Before, when we starting this, there is 2 paper. 1 paper for pediatric, 1 paper for adult. Now it's combined, but only 1 paper. Yan, fever, cough, shortness of breath, headache, nausea, and vomiting. Yan. If 4, ask the patient to perform hand hygiene, wear a mask, direct patient through the respiratory pathway, and inform the physician. That's. And then lastly, sign the staff name and the ID number. This is confidentiality of the patient. Regarding of this data, I will show you the has on how to just read only online. Next, this is designated. Anyway, this is not. I will open to you, doctor, how we enter the data into our surveillance. This is the important one. We show. just like our portal. Sorry. Sorry, no internet no, not working the ano. Wait, I will try one. But there is I don't know what happened, but it's not working. Anyway, okay. Uh, we do as quick entry. You will get only the name of the date of the patient, and then the next steps you will type all only just the ID of the personal identification of the patient. Like yesterday example, if there is concern regarding the data result, it must be inform us the infection control because we need the one to be update of this case. Like if example there is a question regarding the name, regarding the age, regarding the result, and sometimes it happened like other scenario case that happened that sometimes the female become male. So before we give the result to the patient, it must be first we will check for it. Why? To keep the information correctly so that they have a better information regarding of their identity. Because we are the one responsible. Me, I'm responsible for the issuing also for all, not only the our case, and also in other like our immunization like this. It's same. Now, they can, if quick, they can uh, print using only the ID. But Jake, you know now already how to print the investigations. Okay, regarding the investigations, as long if the patient come and just ask the ID, just search, and then go to the investigation portal, and it will appear there. Then before issuance of the result, it must be stamped by our infection control department like this. And then the copy should give to the doctors in the ER. Like Dr. Ayman. Saan, Dr.? Yeah, okay. Okay, last. This is the last. MERS. This is also ano. And there is a guideline also. How many page? I will see. This is our guidelines for healthcare professionals for MERS scope. Yeah. And then I will go now already to the policy because this, we need to. Okay. Our policy for this is to provide the guidelines about MERS code definition and treatment. And then we also have a case definition, and this also already there in the bulletin board. So you have two, one for COVID, one for MERS code. So it's there in the bulletin board ER. Again, who is responsible? Healthcare workers, nurses, physician, and ITC department. Why? To prevent transmission of respiratory infection to healthcare inside the healthcare setting. Okay, the visual triage is used for identification of all patients with acute respiratory infection and the emergency room. Our visual triage station, we have two, one for the OPD entrance and one for the bus for ER. Before we only have one, now we are two. So we are implementing two, one for the entry, one for the OPD entry and then bus only for the ER. Okay. They should ask to perform hand hygiene and wear a surgical mask. They should be isolated and evaluated immediately in areas separate from patient, ideally separate room, acute respiratory infection. Our acute respiratory infection clinic. And then what is the mandatory rules in our isolation room? It have a infection control has a memo that only that room used for isolation must provided with the checklist of our negative pressure. And how is the uh, monitoring checklist? What's inside is if there is patient is daily cleaning, and then if no patient, weekly cleaning, and then if in 1 month you will inform the company to check the negative pressure of our isolation. Post visual alerts and operate a language at the entrance of healthcare facilities. This one is the one they use. Post alert is the one including that they call post alert. Then prevent over.
Contact with the government to check
Our engineer,
parameters.
yeah. Our parameters. I do the checklist with quotation note there that if there is the no our engineer Mujahid. Yes. And then it will check. Overcrowding clinical areas to reduce the risk of transmission between patient and to the staff. Distance should be maintained between patients' bed, minimum of 1.2 meters. And then 2.4 meters in critical care areas. Again, they mentioned the transmission-based precaution. This is the one I already discussed in our call with same. Okay, we know now already our placement. We have isolation room inside in the air, and patients will transmissible infections, including airborne infection. The infection control team should take the lead in managing isolation rooms. Patient transport, avoid the movement and transport of patient out of the isolation room or area unless medically necessary. The use of designated portable X-rays, ultrasound, or echocardiogram and other important diagnostic machines recommended when possible. Again, they mentioned the PPE, of course. Same. Now, okay, the fit test. The fit test will check protection offered by disposable particulate respirator N95. I already request for another batch of N95, the one with this 1860. For healthcare workers who have facial hair that comes between the ceiling surface, the face for the wearer, powered air purifying respirator. We don't have text. Same. Yeah. Healthcare workers shall not resume their duty until cleared by infection control team. That's why sick leave we have also. We are already in our staff health program. That's why the sick leave stamped by Amir and they check and they give to the patient. Outbreak management. Defined as evidence of one or more secondary transmission of MERS within the healthcare facility. Duration of isolation precaution of MERS-CoV infection. That effectivity for MERS-CoV may last as long as virus is being shed. Out of protocol testing is confirmed as patient. It's discouraged. Yes, this is the surveillance and reporting. We have this. The one I told you, there, Hassan, Health Electronic Surveillance Network System. Mentioned. Laboratory testing for MERS-CoV performed to confirm clinically suspected case to screen contacts as per approved protocols. So we have important collaboration team with the laboratory department. Okay, doctor. Okay, since Miss Jake is here, I will let her to perform the PPE. For example, there is case in our isolation. Come, Jake, so that after this finish, the PPE for you. Yeah, come. I will. Just come. I prepare for you. This is the first, only one. Yeah. Start from the now, the hygiene. Yeah. Start from the hygiene.
You are on vacation today.
Yeah, I'm on
Okay.
doctor. We start for hand rubbing. Yeah. You will do it for 20 to 30 seconds. And then the gown. The gown. So it should be tied. Next, ensure. After that, you should use the next side. Open, open. Yes, that's for you. Change na your. It should be fit in your face. But for me, it's not. That's for me. It's very big. And then after this, you will use the, if you have available goggles or face shield, you will use that one. And then the last one you will use is the sterile gloves. We had head cap, of course, head cap, and then sterile gloves. After that, when you remove, first you will remove the gloves and put it in the yellow container. And then if in case your hands are contaminated, you can do hand rub again. And then remove the head cap and the face shields if you have, and then the gown. The last you will remove is the N95. Thank you, Miss Jake. Perfect, perfect. Okay. Okay, yes. Thank you. It's finished now, doctor. Thank you for no, we will have now already. No. Yeah, yes. Yes. We will have because I already have a request for it and then it will come. Because thank you for coming.
Small size.
Thank you, doctors, for cooperation and coming. And next time, inshallah, again. Yeah, thank you. Thank you, Mats. Okay, doctor. Shukran, ha?
Good.
Yes, doctor. Okay, thank you. Yes. Yes. Inshallah. Yes. Thank you for cooperation. Thank you, doctor.
For your approach
Okay.
and
Okay.
good
Take care,
job.
doctor. Tingin kami ng guidelines later. Thank you for watching.